Morning, Mr. Contreras. Can you see and hear me okay?
Hi, Austin. Yes, I can hear you great. How are you
Great.
doing?
I'm well, thank you. Thank you so much for taking the time to meet with us today. We are from the Hepatitis Appropriations Partnership, HAP. My name is Austin Rios. I'm a fellow on the Hepatitis and Policy and Legislative Affairs teams at NASDAD. We greatly appreciate your time with us today, but before we get started, I'd love to take a moment and introduce the other members of my team. Michaela, would you like to introduce yourself?
Sure. Hi, I'm Michaela Jackson, and I'm the Prevention Policy Manager for the Hepatitis B Foundation. Frank?
Good morning. My name is Frank Hood, and I'm the manager of hepatitis advocacy at the AIDS Institute. Robin?
Hi, my name is Robin Lloyd Smith. I'm Community Engagement Coordinator for National Viral Hepatitis Roundtable.
And hi, I'm Daniel Raymond. I'm the Director of Policy for National Viral Hepatitis Roundtable. Thanks for your time.
Thank you, Mr. Contreras. So we are, again, the Hepatitis Appropriations Partnership. I'd like to first start us off by asking if you have any familiarity with what hepatitis is.
I've heard about hepatitis a little bit, but I'm not too familiar with it. So whatever you have to share, I think that would be helpful.
Absolutely. Well, Michaela, would you like to introduce what hepatitis is to Mr. Contreras?
Absolutely. Thanks, Austin. So I can just start by doing a quick overview before turning it over to my colleagues. So essentially, hepatitis means a viral infection of the liver, and there's about 5 different forms of viral hepatitis, but today we're going to focus on B and C, which are the ones that impact the US the most. So starting with hepatitis B, there's about 2.4 million Americans living with chronic Hep B. And over the past couple of years, we've seen it increase about 11% across the US. And hepatitis C, we've seen it increase about 484% since 2010. So it's clearly a really big issue. And the reason that we're seeing such increases with viral hepatitis is that there is an intersection with the opioid epidemic and a lack of resources. And so hepatitis B is preventable. There is a vaccine for it, but there's no cure. Hepatitis C, there is a cure, but there's no vaccine. But there's a lot of opportunity to prevent both viruses and to make sure people can seek treatment that they need as well. And perinatal transmission is a big deal for both hepatitis B and hepatitis C. So that's something that is really crucial to address as well. And the intersections with the opioid epidemic and other forms of transmission. And so I can pause there if you have any questions. If not, I can turn it over to Daniel to talk a little bit about how it impacts your jurisdiction directly.
If you could speak specifically about how the role of the opioid epidemic plays in spreading hepatitis, I think that would be helpful for me to understand.
Sure, absolutely. So if anybody has anything else they want to add, please feel free to jump in. But essentially, it plays a role because injection drug use is a big part of the opioid epidemic. And when people don't have access to clean and sterile syringes to get the resources that they need, they can't get access to the care that they need or access to the vaccine for hepatitis B. It really hinders the ability to help the viral hepatitis services on the ground to work with that community and prevent transmission.
Got it. Thank you.
Mm-hmm.
I can talk a little bit about how these national trends are playing out in your boss's jurisdiction. What we're seeing, as Michaela said, is that we've had these issues with viral hepatitis for decades, and we had a sense that there was hope that, as Michaela said, there's a vaccine to prevent hepatitis B. It's high uptake amongst young people, less uptake amongst adults because we've only had it for about 30 years. So we're really interested in making sure that the vaccine is more available, that uptake is better. And we were really pleased that in the last few months, CDC's Advisory Committee on Immunization Practices for the first time endorsed universal adult vaccination for everybody between ages 19 and 59. We think that getting the word out about that, making sure that it's easy, convenient, affordable, and accessible to get vaccinated, whether it's at your doctor's office or at a pharmacy or Minute Clinic, is going to prevent a lot of new infections and ultimately save a lot of lives. Because when we talk about hepatitis, what we're really worried about is the long-term consequences in terms of liver disease and mortality. We looked at the numbers for your boss's state before this meeting, and we're seeing some disturbing trends. With hepatitis C, new infections have definitely gone up considerably over the last several years, mirroring the national trends that Michaela talked about. And there's a clear link between that and the broader overdose crisis, whether we're talking about prescription opioids, heroin, fentanyl, or more recently, stimulants like methamphetamine. We're seeing this play out in a lot of different ways, that both the shortage of legal access to sterile syringes that results in people sharing injection equipment and potentially transmitting hepatitis C in the process, but also the relative gaps in the drug treatment system, which means that even when people are trying to seek help, they may face waiting lists. There may be shortages of doctors that can provide medication-assisted treatment, such as buprenorphine, to people with opioid use disorder, mean that we have this whole bolus of people who've been rendered vulnerable to both hepatitis B and hepatitis C because we don't have the adequate structure to prevent new infections, to diagnose them, and to make sure that people who are living with these viruses get promptly linked to effective care and treatment. And so we're hopeful that what we're seeing happening in your state is starting to happen around the country. CDC funds viral hepatitis coordinators and viral hepatitis programs in virtually every state, including yours. And as part of that funding, they ask that states work with stakeholders across the state, diverse stakeholders from lots of different sectors, to develop a viral hepatitis plan. And that work is happening in your state. There's some fantastic people at the state health department who are spearheading it. And some of our colleagues are deeply involved and invested in making a plan that can fulfill the vision of eliminating viral hepatitis as a public health threat by 2030. But the thing that we consistently hear and see is that jurisdictions like yours need the resources to put those plans into action. And that's why we're here to talk about what we're looking for in the appropriations process this year. I want to pass it to my colleague, Robin, who also has a good vantage point on these issues.
Hi, thanks for having us today. My name is Robin Lloyd Smith, and I am a constituent, actually. I live in our beautiful state, and I wanted to just let you know a little bit about my journey as someone that was living with hepatitis C for many years and had no idea. Fortunately, I did have a doctor eventually test me, diagnose me, but I had a lot of trouble accessing treatment and medication. It actually took me a couple of years. At first, I didn't think I was ever going to be able to be cured of this infectious disease I was living with. But there were, because of some of the work that has been done in the state, I was able to finally find a clinic to help me. But at that point, I had pretty advanced liver disease. I was right on the verge of cirrhosis, starting to feel a little bit better, but I just think it's really important for us to spread the word. So many people still are not diagnosed, and we don't have the support we need to get programs like the one I was able to access out there. I have since in this short time gotten to know a lot more people in this state that are challenged, and we're still having a lot of trouble. We're still having a lot of trouble with access. People are denied treatment initially. All this could change. We know there's a national action plan. There are a lot of great solutions, and we really need your support. We need your support in the state and federally to get programs to prevent more people from suddenly finding out they're very sick, and to prevent more cases. Because it really is impacting our state incredibly. We have some pretty high new incidence numbers from what we can see. It can be very difficult living with an infectious disease. It can be very difficult talking to people about it, spreading awareness, and even talking to your doctor about it. And one of the things that we really hope as people who have lived with this virus is that we can bring this out into the air more, and really let our folks in West Kakalaki, Indiana, Terrium know that this is something that can be identified and cured. So I'm really happy that you've let us share this information. Love to be a resource for you in any way. And if you have any questions, I could certainly give you a lot more detail on some of the things that are happening and not happening that we could really use your help with.
Thank you for sharing your story, Robin.
You're welcome. I'm sorry.
No, and thank you, Robin. And my name's Frank Hood. As I said earlier, I wanted to pop in and talk about, we've talked a lot about what's happening in hepatitis and what that impact looks like on the ground in terms of public health and in terms of your constituents. But I wanted to take this opportunity to talk about the two specific line items that we advocate for that really support these efforts on the ground that drive us to elimination. So the first one I wanted to talk about lives within the CDC. It's the Division of Viral Hepatitis, which incorporates their viral hepatitis programs. It is currently in FY22 was only funded at $41 million. And that's significantly below the need, as we've seen from professional judgments, which place that amount at nearly 10 times, meaning something close to $400 million a year to really put the U.S. on a path towards elimination. Our ask is not that high need number, but it is does represent an investment that is needed in order to really boost the hepatitis prevention, education, testing, and surveillance efforts nationwide. And increased funding really would expand that infrastructure to allow screening and linkage to treatment and improve surveillance in a way that is really lacking, which is why the community has asked for a $140 million request for FY23 for that line, which is a $99 million increase. But as I said, still represents, barely a third of what the actual need in this space is to put the U.S. on a path towards elimination. Additionally, you've heard and have seen firsthand the significant impact that injection drug use and lack of sterile injection drug use with lack of sterile injection equipment can have on the ground in terms of new cases of hepatitis B and C, as well as potential hepatitis A outbreaks and other infectious disease consequences. If we are to reduce the risk associated with injection drug use and to give individuals the opportunity to link into healthcare and to overdose prevention items, we really need to expand the number of sites that exist, giving harm reduction, or that the number of sites employing harm reduction practices in the US. And that work is supported by the infectious disease and opioids line within the CDC. And that last year was funded at $18 million. And we are asking for an increase to $150 million. And this would allow the US to support areas currently experiencing or most at risk for infectious disease outbreak as a result of that lack of sterile injection use or sterile injection equipment. And would also allow targeted testing and linkage programs and vaccination and prevention programs in priority communities that impact not only hepatitis, but other infectious diseases. So these are the two specific funding lines, and I'm happy to answer questions you may have, but I will turn it back to Austin.
Yes, thank you, Frank. I appreciate that. And thank you to all our team members on the call today. Well, Mr. Contreras, we have shared a lot of information with you today, and we'd like to offer you the opportunity to ask us any questions, or if you have any thoughts that you need clarified with us while we're on the call with you this morning.
Yeah, I'd just like to say thank you all again for the time that you've taken today and to uplift the important need. I didn't realize that the rates of hepatitis were increasing or made the connection yet with the opioid epidemic. I think especially after everything we've seen through with COVID, my congresswoman is definitely in support of addressing infectious diseases and kind of thinking through ways to improve our public health system in the long term. But I did have a few questions for you all. You spoke a bit about the work that's happening in my state and developing statewide plans. And I'm wondering if an increase to these funding lines would boost that work happening in the state, or whether it would apply to kind of like the whole federal level.
Yeah, I'd like to see if Mr. Raymond, do you have any thoughts on that for Mr. Contreras?
Sure, I can start and anybody else can feel free to add. That's what we're hoping for. We think that CC set up a great framework to get money out to states to not just design, but deliver on the planning work that they're doing. However, given the funding level that we're currently at, most states only have in the ballpark of, a few $100,000 worth of funds. And when you think of the millions of people across the country who have chronic hepatitis B or chronic hepatitis C, plus the prevention needs, then you can quickly see how that doesn't actually stretch very far. So we're hoping that the plans that states such as yours are developing right now could benefit from a significant commitment of new investments so that actual implementation on the ground, whether it's about new testing programs or training healthcare providers or combating stigma or improving vaccination rates, actually really materializes, because there's so much goodwill and good efforts going on in trying to figure out how to get solutions to these epidemics, that it would be a tragedy if we weren't able to support those efforts by local leaders to really eliminate viral hepatitis in the next decade.
Thank you. And do you see the two programs as linked in the DVH prevention program for hepatitis and the IDO? Do you see them as one requiring a boost if the other one requires a boost, or do they operate independently?
They technically operate independently, but I will say that boosting both will help put investments into the multiple priority populations that need to be targeted. And so boosting one without the other will reduce the effectiveness of the investment that is boosted, but that shouldn't stand in the way of only increasing one if that is all that's available. But for the most robust, in order to actually achieve elimination, both do need to be boosted at significant levels. And that has been outlined in HHS's document around the National Strategy for Viral Hepatitis Elimination, as well as other reports that other entities have done looking at what is needed for elimination in the country.
Got it. Thank you. Well, I can certainly take these requests to the Congresswoman and follow up if she has any more questions about the specific dollar amounts and what they can purchase, especially when it comes to our state.
Very good. Well, Mr. Contreras, we certainly appreciate your time this morning. Thank you. I'm happy to make myself available should you have any questions in the future. I've sent my contact card to your email. Should any of the Hepatitis Appropriations Partnership members on this call can be a resource for you in the future. Thank you. We greatly appreciate it.
Thank you so much, everyone. I appreciate it.
Thanks for your time.
Thank you.